Hello everyone, let's try to solve this question together. So we have an infant here who's delivered at 35 weeks of gestational age by spontaneous vaginal delivery with a history of light meconium. The infant was suction and dried. The Apgar score was 9 and 9. The staff calculated the risk of sepsis from the required data, and this is the abbreviation which will show in the next slide. And based on the early onset sepsis output, which is displayed here, the best action is to pause the slide, zoom the picture. Okay, the correct response here is obtaining blood culture but no antibiotics. And you guys can question why is that, and we'll show in the next slide. But the clue here is, see this, the composite score here is greater than this but less than this. So infant probably will fall somewhere here, and this is a well appearing infant. So probably C is not the right choice because obtaining a culture is not really indicated because infant is well appearing. And chest x-ray is not a part of early onset sepsis, although there was some meconium, but that's not the right choice. Now let's see in the next slide where we are. So like this was we were saying, so basically IgT, RGA, you can remember either way. So this is incidence, gestational age, temperature, rupture of membrane, GBS status, and intrapartum antibiotics. So you need this six component to calculate the score. So now let's walk through. So whenever this output is displayed, always look at which category the infant is falling. If infant is on respiratory distress or is requiring, is tachycardic and patient is equivocal, you have to go with this and probably better off following the recommendation. If infant is, having other issues and is clinically ill, then of course you will follow this. Only for well appearing, you can, do the thing which is displayed here because this composite number is showing that. So now let me clean the board and again walk you through. So the first thing is you have to look at where you are in clinical scenario. Then of course this paper was well appearing. So now you look at the composite score of well appearing and see your score, what you got. So as your score, what you got is greater than that, you have to follow this algorithm. So basically because the composite score is falling between 1 and 3, still the blood culture is the better option, and you can do the vital signs every Q4 hours. So again, the clue here was that it's not just simply looking at the output. You have to know where is the difference between your total and the recommended thing, and then follow this. And this is again taken from the same resource. They are updating the recommendation, so hopefully we'll have the new update pretty soon. But for now, just remember, whenever you get an output, always see first what is the clinical state of the baby. If clinically baby is well appearing and your score is higher than well appearing, then doing a blood culture and following it will be better rather than doing the full antibiotics. And again, these are like really guidelines. You have to use your clinical judgment. So I hope you guys have learned something together today. You guys have a wonderful day. Bye.